Welcome back. If you've just joined us, you're watching the news at 10 on Channels Television, coming to you live from Lagos. A reminder of our top stories. The National Economic Council demands refund of 526 billion naira and $21 billion, allegedly underpaid to the federal government by the NNPC and 16 other revenue-generating agencies. Federal government refutes rumour of state sponsorship of farmers' herders' crisis, insists issue is neither ethnic nor religious. Armed bandits kill 7, injure 5 others in Birnin-Gwari, Kaduna State. Chief of Army Staff vows to ensure attackers are tracked down. And North Korea vows not to resume talks with South until issues between the two countries are resolved. Now, channelstv.com has more information for you, and on youtube.com/channelsweb, you can watch our videos. You can also watch us on your mobile device via your browser or download the Channels TV app for Android, iOS and Windows devices from their respective stores. Besides giving you access to news updates on the go, the Channels TV and Channels 24 app have an eyewitness feature that you can use to share pictures, videos or news of happenings around you. Just install the app and then tap and swipe to reveal the menu and then follow the instructions. There are reports of fresh attacks by armed bandits on Waduku community in Lamurude local government area of Adamawa State. The chairman of Lamurude Local Government Council has confirmed the attack, and he says the bandits invaded the community around 5:30 p.m., shooting at residents. No casualty has been recorded so far, as Channels Television's correspondent reports that the details are still sketchy. The attack is the second in less than 2 weeks in the area, as armed bandits reportedly attacked 5 communities in neighbouring Numan local government area of Adamawa State. Two health issues and members of the Joint Health Sector Union, who have been on strike for 4 weeks now, have directed their affiliates in Lagos, Kano and Yobe states to suspend the industrial action, as the states have complied with the agitations for salary adjustment. But the striking health workers accuse the Federal Ministry of Health of being a major barrier to the resolution of the issues that led to the industrial action, as they call for the immediate removal of the Minister of Health, Professor Isaac Adewale. Last week, Johesu members compelled members in states and local governments to join the industrial action after several negotiation meetings with the federal government failed to resolve the impasse.
It is paramount we seize this cause to specially convey deep appreciation to state governments which have gone ahead to meet the various clamors and terms of settlement in agreements with government. This includes Yobe and Lagos states, which have now adjusted the current scale as demanded. We especially commend the Lagos state government for approving the consultancy cadre for pharmacists in its employment, just like the Niger State government did with pharmacists since 2012. The JSU also expresses gratitude to the Kano State government for ensuring good welfare package for its healthcare workforce, in addition to the intervention of His Excellency Governor Ganduje to ameliorate the ongoing strike action. We urge our members in Lagos, Yobe and Kano to tactically relax the strike to accommodate emergency services in those states as a measure of goodwill. Prayers. President Buhari should immediately remove Professor Isaac Adewale from office, as his continued stay remains a major barrier to the resolution of the ongoing nationwide strike of health workers. This is a major threat to public health, especially at a time that the dreaded Ebola disease is currently rampaging in some African countries.
Well, let's cross over to Abuja now. Here's Gloria Umezuke. Gloria?
Hello, Ijoma. The United Nations is asking the federal government to eliminate service charges for people living with HIV and AIDS who try to access treatment in government hospitals in order to reduce HIV and AIDS-related deaths in the country. The Global Fund Advisor for the United Nations Program on HIV and AIDS, Mr. Richard Amenya, says such hidden charges are a major barrier to accessing treatment for HIV and AIDS in Nigeria. Mr. Amenya, who was speaking at the 2018 annual candlelight procession for victims of HIV and AIDS in Nigeria.
We shall fight in Sokoto.
For over 3 decades, since 1983, the United Nations designated May 17 as Candlelight Memorial in honor of all who have died of HIV and AIDS across the world. Representatives of the United Nations, as well as network of people living with HIV and AIDS, are in this hall in Abuja to mark the 2018 Candlelight Memorial. Prayers for the souls of the reposed were also offered. Followed by a news conference where both the United Nations representative as well as members of the network of people living with HIV and AIDS appealed to the federal government to eliminate all treatment charges that limit access to antiretroviral drugs.
The good news that we want to see going into the future is 0 new infections, 0 AIDS-related deaths, and 0 discrimination. And for sure, we can only get here when everybody has access. Everybody who needs HIV services has access to HIV services. What is the point in having drugs in our facilities that people cannot access because they cannot pay the user fees? And so advocacy from the UNAIDS that we cannot achieve our 1990 target if user fees continues to be a barrier.
Antiretroviral therapy for HIV positive people is prevention, and the combination benefits of improved health needs to be encouraged for everyone. We're calling on the government of Nigeria and everybody to join hands together so that we can be able to implement our test and start policy, and our catch-up plan in the country needs to be accelerated.
According to the United Nations, an estimated 3.2 million people live with the HIV virus in Nigeria. 2.9% of this figure are adults, and only 31% of the population are on treatment, thereby leading to an estimated 160,000 AIDS-related deaths in 2016 alone. Although new infections have declined by 21% since 2010, the consensus at this memorial procession is that there is urgent need to step up interventions and increase access to treatment for people living with the HIV virus.
Well, let's take a further look at the issue of access to treatment by persons living with HIV and AIDS. And I'm now being joined by the Global Fund Implementation Advisor of the United Nations Program on HIV and AIDS, Mr. Richard Amenya. Thank you for joining us on News at 10.
Thank you very much. It's a pleasure to be here.
Well, statistics from the UN reveals that 160,000 AIDS-related deaths occurred in Nigeria for the year 2016 alone. I mean, what can be done to reduce this figure?
Sure. Thank you very much. 160,000 people dying of AIDS in Nigeria in 2016 is very unfortunate. And that translates to about 440 people dying on a daily basis. So that is a huge concern, and because Nigeria has the second largest epidemic globally, and it is important that we try and reduce deaths. Even though we don't have cure for AIDS, there are drugs that can save people's lives, and clearly when people have access to these drugs, those people will not be dying. And what we need to do, basically, is to identify people who are infected early and then ensuring that they have access to these life-saving drugs that are available in most public hospitals in the country. And then also maintaining them and retaining them on treatment such that they will be virally suppressed. What is important is that currently, as we speak, about 64% of Nigerians who are HIV positive do not know their HIV status. Only 34% know that. And so we have a lot of work to do to identify people who are positive, and be able to refer them to care and treatment. As we speak, about 1 million people have access to antiretrovirals in Nigeria. That is huge.
But from what you have gathered, really, on the issue of hidden service charges on antiretroviral drugs. How widespread is this practice in government-owned hospitals?
Well, user fees mainly are usually government-sanctioned fees, and that is supposed to help hospitals generate some internal revenue to be able to do some of their running costs and all that. And so they charge patients in order to have resources to provide other related services and also ensure quality of services. But unfortunately, persons living with HIV, most of them are poor and are not able to access this drug. They don't have the resources. So, and if you see, the UNAIDS is talking about having equity and leaving nobody behind. And so because of this, it is important that government is able to do something about addressing the charges that are becoming red tapes or barriers to accessing.
But what can the UN do to increase access, more access to antiretroviral drugs?
Basically, what we are doing is to bring out the barriers of people having access to these drugs. And next week, there's going to be a World Health Assembly, and the Executive Director of UNAIDS, together with the Ambassador Bex of PEPFAR, are raising this issue of user fees that is becoming a barrier. The point is that you have Global Fund and PEPFAR that are investing significantly into saving people's lives. These drugs are in the hospitals. And so if you have user fees becoming a barrier to people having these drugs, then don't be surprised that you have about 440 people dying on a daily basis in Nigeria.
Well, I'd like to thank you very much indeed for coming to join us on News at 10.
It's a pleasure to be here. Thank you.
Well, we have with us Mr. Richard Amenya. When the News at 10 returns, African Development Bank approves a $100 million loan for Nigeria's Indorama Eleme Fertilizer and Chemicals Company. That's when Business News. Please join us again.